Lost in time, the heartbreaking reality of dementia patients asking for their parents. Dementia is a cruel disease that affects millions of people worldwide. It is a heartbreaking reality that many dementia patients experience moments of confusion and disorientation, often leading them to ask for their parents, even if they have long passed away. This can be a difficult experience for both the patients and their loved ones, as it is a reminder of the devastating effects of dementia. In this post, we will explore the emotional impact of dementia on patients and their families, as well as the treatment options available to help manage the symptoms. We will also discuss ways in which caregivers can provide comfort and support to dementia patients who are lost in time and longing for their parents. Join us as we delve into this difficult yet important topic. 1. What is dementia? Dementia is a syndrome of cognitive decline that affects memory, thinking, behavior, and the ability to perform everyday activities. It is caused by damage to the brain cells, which can be a result of several diseases or conditions, such as Alzheimer's disease or stroke. Dementia is a progressive disease, which means it gets worse over time and can eventually interfere with a person's ability to carry out even the simplest tasks. The symptoms of dementia can vary from person to person, but generally, the early stages are characterized by forgetfulness, difficulty with language or communication, and confusion. As the disease progresses, individuals may experience mood swings, personality changes, and difficulty recognizing familiar faces and places. They may also have trouble with basic tasks such as dressing, bathing, and eating. One of the most heartbreaking symptoms of dementia is when patients start asking for their parents, even though they have long passed away. This is due to a confusion of time and memory, where their brain is stuck in an earlier time when their parents were still alive and they were young. It is a poignant reminder of the devastating effects that dementia can have on individuals and their families. It is important to recognize the signs of dementia and seek medical help as soon as possible to provide the best possible care and support for those affected. 2. The stages of dementia. Dementia is a progressive disease that affects the brain's ability to function properly. There are several stages of dementia, each with its own unique set of symptoms and challenges. In the early stages of dementia, an individual may experience mild cognitive impairment, which can include forgetfulness, difficulty concentrating, and trouble with language and communication. While these symptoms can be concerning, they are often attributed to normal aging and can be difficult to diagnose as dementia. As dementia progresses, the symptoms become more severe and can include confusion, disorientation, and difficulty with basic tasks such as dressing, bathing, and eating. In the middle stages of dementia, an individual may begin to experience personality changes, mood swings, and behavioral problems that can be challenging for caregivers to manage. During the late stages of dementia, an individual may experience a loss of mobility, difficulty communicating, and may require round-the-clock care. At this stage, individuals with dementia may become increasingly agitated or withdrawn, and may have difficulty recognizing family members or caregivers. It's important to note that dementia affects each individual differently, and the progression of the disease can vary widely from person to person. With proper care and support, many individuals with dementia can continue to enjoy a good quality of life for many years, but it is a heartbreaking reality that some may eventually lose touch with reality and may even ask for their deceased parents. 3. The heartbreaking reality of patients with dementia asking for their parents. One of the most heartbreaking realities of patients with dementia is their tendency to ask for their parents, even if their parents have been gone for years. This can be a very difficult situation for family members and caregivers to deal with, as they struggle to find a way to provide comfort and reassurance to their loved ones. It's important to remember that when someone with dementia is asking for their parents, they are often living in a world that is very different from our own. They may be experiencing confusion, disorientation, and a general sense of unease. For them, asking for their parents may be a way to find comfort and a sense of security in a world that feels unfamiliar and frightening. There are a few things that family members and caregivers can do to help patients with dementia who are asking for their parents. One of the most important things is to be patient and understanding. Try to listen to what the patient is saying and respond in a gentle and reassuring manner. It can also be helpful to redirect the patient's attention to something else, such as a favorite activity or a pleasant memory. It's important to remember that patients with dementia may not always understand or remember what you say to them. However, your kind words and actions can still provide comfort and reassurance, even if the patient doesn't fully understand what's happening. By being patient, compassionate, and understanding, you can help make life a little bit easier for someone with dementia who is struggling with the loss of their parents. 4. The reasons why patients with dementia ask for their parents. One of the most heartbreaking realities of dementia is when patients ask for their parents, even though they have long since passed away. This can be a confusing and distressing experience for both the patient and their loved ones. It's important to understand the reasons behind this behavior, in order to provide the best possible care for those affected by dementia. One reason why patients with dementia may ask for their parents is due to the loss of short-term memory. They may not remember that their parents have passed away, and may still believe they are alive. The patient may also be experiencing a regression in their cognitive abilities, causing them to revert to a time when they were younger and their parents were still alive. Another possible reason is that the patient may be experiencing feelings of loneliness or isolation. Asking for their parents could be a way of seeking comfort and familiarity, as they may not recognize their current surroundings or the people around them. It's important for caregivers and loved ones to approach the situation with empathy and understanding. Redirecting the conversation and providing comforting reassurance can be helpful in easing the patient's distress. Creating a soothing and familiar environment, with objects and photos that are associated with positive memories, can also provide comfort and support for patients with dementia. 5. How to respond when a dementia patient asks for their parents. Dealing with a dementia patient can be very challenging, especially when they start asking for their parents, who may have died a long time ago. It is important to understand that for dementia patients, their reality may be different from ours. They may believe that they are still young and living in their childhood home, surrounded by their parents and siblings. When a dementia patient asks for their parents, the best response is to not correct them or argue with them. Instead, try to redirect their attention to something else that they enjoy or can relate to. For example, you could try talking to them about their favorite hobbies or interests, or show them old family photos that may bring back happy memories. It is also important to reassure them that they are safe and cared for. You could remind them that you are there to help them and that they are not alone. You could also try using comforting gestures such as holding their hand or giving them a hug, which can help to soothe them and make them feel more secure. It is important to remember that dealing with a dementia patient can be emotionally draining, and you may need to seek support from family, friends, or healthcare professionals. With patience, empathy, and understanding, you can help to make the lives of dementia patients more comfortable and meaningful. 6. The importance of empathy and understanding. Empathy and understanding are crucial when it comes to caring for individuals with dementia who may ask for their parents. It's important to remember that they are not trying to be difficult or manipulative, but rather they are experiencing a genuine confusion and disorientation. It's easy to feel frustrated or impatient when a person with dementia asks for their deceased parents or for a parent who is unable to visit, but it's important to approach the situation with kindness and understanding. One way to show empathy is to acknowledge the person's feelings and validate their experiences. Instead of saying, "Your parents aren't here, stop asking for them," try saying something like, "I can see that you're missing your parents, tell me more about them." This not only acknowledges their feelings but also provides an opportunity for them to reminisce and share memories. It's also important to remember that nonverbal cues can be just as important as the words we use. A warm smile, a gentle touch, or even just sitting quietly with them can help to create a sense of comfort and security. In short, treating individuals with empathy and understanding goes a long way in providing them with the care and support they need. It's important to create a safe and nurturing environment where they feel valued and respected, regardless of their cognitive abilities. 7. Understanding the impact of dementia on the family. Dementia is a disease that not only affects the person diagnosed with it but also their families. As the disease progresses, it becomes more challenging for the family to care for the person with dementia. Watching a loved one slowly slip away can be incredibly difficult and heart-wrenching for everyone involved. It is common for people with dementia to ask for their parents, even if their parents have long passed away. This can be a heartbreaking experience for their family members who are left feeling helpless and unable to provide the comfort their loved ones seek. Sometimes, this can cause confusion, frustration, and anxiety in the patients, which can further complicate their condition. The family members of people with dementia often feel a tremendous amount of stress and worry about their loved one's well-being. They may have to take on additional responsibilities, such as managing finances, ensuring their loved one is taking medication, and providing emotional support. This can be emotionally and financially draining, especially when the family members have other obligations such as work and other responsibilities. It is important for families of people with dementia to seek support from others who understand their situation, such as support groups or professional counselors. This can help them cope with the changes and challenges that come with caring for a loved one with dementia. By understanding the impact of dementia on the family, we can work towards providing better care and support for those affected by this heartbreaking disease. 8. Coping strategies for family members of dementia patients. Caring for a family member with dementia can be challenging, especially when they start to ask for their parents, who may have passed away a long time ago. It can be a heartbreaking moment for both the patient and their family members. However, there are coping strategies that can help family members deal with this difficult situation. The first strategy is to stay calm and patient. It is important to remember that the patient is not intentionally trying to upset or confuse you. Respond to their questions in a gentle and reassuring manner, and avoid correcting them or arguing with them. Another coping strategy is to redirect their attention to something else. You can try to distract them with a favorite activity, such as listening to music, looking at old photos, or going for a walk. This can help to shift their focus away from the past and onto something more positive. It is also important to take care of yourself as a caregiver. Caring for a loved one with dementia can be emotionally and physically draining. Make sure to take breaks when you need them, and seek support from other family members or a caregiver support group. Finally, it may be helpful to seek professional help from a therapist or counselor who specializes in dementia care. They can provide guidance and support for both the patient and their family members during this challenging time. Remember that coping with a loved one's dementia can be a long and difficult journey, but with the right strategies and support, you can help them to feel loved and cared for throughout their journey. 9. The role of caregivers in supporting patients with dementia. When it comes to dementia patients, caregivers play an essential role in supporting them. Caregivers provide a stable and safe environment for the patient, which can help to reduce the symptoms of dementia and enhance their overall quality of life. One of the most important things a caregiver can do is to establish a routine that is easy for the patient to follow. This can help to reduce confusion and anxiety, which are common symptoms of dementia. Caregivers should also be patient and understanding, as dementia patients can become easily agitated or frustrated. Another important aspect of caregiving is to ensure that the patient is eating a healthy and balanced diet. Dementia patients may have difficulty with eating and drinking, so it's important for caregivers to be vigilant in monitoring their eating habits and ensuring that they are getting the proper nutrition. In addition to physical care, caregivers also play a crucial role in providing emotional support to dementia patients. This can include listening to their concerns, providing comfort and reassurance, and engaging them in activities that they enjoy. Caregiving for a dementia patient can be challenging, but it's also incredibly rewarding. By providing compassionate and attentive care, caregivers can make a significant difference in the lives of those with dementia and help to ease the burden on their families. 10. The need for more awareness and resources for dementia patients and their families. Dementia is a devastating disease that affects not only the patient but also their families and loved ones. It's heartbreaking to see a loved one slowly lose their memories and their ability to recognize the people they once knew. Sadly, many families and caregivers struggle to provide the necessary care and support for dementia patients. There is a great need for more awareness and resources to help these individuals and their families. One of the biggest challenges is the lack of understanding and awareness of the disease. Many people still believe that dementia is a normal part of aging, but it's not. Dementia is a disease that affects the brain and causes a decline in cognitive function. Another challenge is the lack of resources and support for caregivers. Caring for a loved one with dementia is a full-time job that can be overwhelming and exhausting. Caregivers need support, resources, and training to help them provide the best care possible for their loved ones. It's important to raise awareness about dementia and the challenges faced by patients and their families. We need more funding for research to find a cure and better treatments to improve the quality of life for those living with dementia. We also need more resources and support for caregivers to help them provide the best care possible for their loved ones. By working together, we can make a difference in the lives of those affected by this devastating disease. We hope that our blog post has brought attention to the heartbreaking reality of dementia patients who often ask for their parents, despite being in their later years. It's a difficult situation for caregivers and loved ones to face, but it's important to have empathy and patience when dealing with these individuals. As a society, we need to raise awareness about dementia and provide support for those affected by it. Thank you for reading and spreading the word to increase awareness about this important issue.